Hey, friends, welcome to the Patriot Barbie podcast. I am doing a powerhouse woman today. This woman has been fighting the good fight for you, for your kids, for your family, for your freedoms, for your medical freedom for years. We're going to hear the whole story, what she's doing now, how she is still fighting for you. If you haven't heard of Jodi O'Malley, prepare yourself for an epic adventure today. Jodi, welcome.
Hey, welcome, Lindsay. Thank
Hello.
you.
Yes, you're such a strong boss, babe. I'm so proud of you.
Thank you. I feel the same about you. So I'm very excited that we finally get a chance to talk.
Yeah, have we ever met? We've met in person, just like briefly, right? Or no?
I don't think so. I don't
What?
think so.
I
Yeah.
feel like I know you.
I know. You know what? Because we see each other on social media.
Yeah,
And let me tell you, I have developed some very, like, my best friends from life from social media
yeah.
over the past 3 years.
You
Yeah.
really find your people, man. When you speak out, you find out who's going to turn their back on you and who's on your team. So,
Oh, yeah, and who just keeps looking,
yeah,
because you
yeah.
don't usually lose followers. They kind of follow you more intently, but they just don't comment.
That's right. Someone influential, I don't remember who it was, said not all followers are fans or something like that. And I was like, "Ooh, good point. People might follow you, but they're watching for when they want to poke at you and slander you and piss you off."
Yeah, yeah.
All right.
We'll talk a little bit about that part about the stalking
Mm.
when we get to the later part of
Ooh,
our conversation. But
juicy. All right, so I guess take us back to 2020. Oh, guys, remember March 23rd? All of America got locked down because we were all going to die of COVID.
yes,
So there we
yeah,
were, staying home, staying safe, praying for a vaccine for a for the for a virus that was killing people on the streets that nobody ever saw.
right.
Where
Pulling
were
dead
you?
bodies out of the home.
Yes,
Yeah,
yes.
yeah.
Fear. Where were you during all this?
Well, it's funny. I was talking with Senator Shamp. She's our
I love her.
senator.
Love,
Love
love
her. Yes.
her.
Talking with her the other day, and she's like, they're saying, oh, the morgues at the hospital are full. And she's like, do people know that even large hospitals only have like place for 3 more bodies?
No wonder they're full. There was a car accident, a four-person car accident.
That's exactly right, Lindsay. That's exactly right.
Oh my
So,
gosh.
yeah. So you mean take you back to March 2020 where the propaganda started?
Yes, that's right
Okay.
about there. We're using a lot of trigger words, by the way. I'm totally getting banned. We've said COVID, vaccine, and propaganda.
This is okay, so let's be a little
No,
bit
it's
more
fine.
careful.
I'm already banned. It's fine. I've already got strikes. I'm like, dude, that would be called a sellout. If I'm like, don't say certain things because we don't want to get deplatformed, it would be like not asking you not to speak the truth.
Well, we can speak the truth. I can play their game. I mean,
Mhm.
how else are we going to get people from, the mainstream social medias that everybody, is familiar with, like the Instagram and the TikTok? I mean, I'm always constantly living on the edge with Instagram and Facebook, so we
Yeah.
just have to be a little bit more clever. So let me be
Let's
clever.
be clever. Shouldn't be a problem for us.
Yeah, I can play the game. Okay, so March 2020. Well, let me take you back a little bit before that. So, and I'll briefly tell you because it's in the book, and my book actually, which is really cool because they asked me, "Do you journal?" And I said, "No, I don't journal." And then I realized I did. I journaled on
Oh,
Facebook. I was
aha.
posting all the time about this. So
Yeah.
so the book is kinda guided by that story. But I was in Seattle in February and got really sick, and really, really sick, the sickest I've ever gotten in my life, like shortness of breath sick, thinking that I'm gonna go to the hospital. But, it's a flu and whatever. I handled it and, took my medications and stuff that
Hmm.
I wanted, and I got over it. I find out in March that there's this virus going around, and so then I found out that Seattle was the hub at that time, and I thought, well, maybe I got it.
Yeah.
Well, if I did, yeah, it was really crappy, but I got over it. And so anyway, I just started noticing the 24/7 propaganda death toll
Hmm.
ticker.
Yep.
Telling my son, even my 10-year-old Benjamin, or 11, he was at 10 or 11, he was at the time, I had just taken him to go see Jojo Rabbit the year before. Have you ever seen that movie?
No, I don't even know what that is.
Oh
I
my
have
gosh.
kids.
Yes.
Jojo Rabbit.
Yeah, so it's not really a kids movie per se. It's a story of a 10-year-old boy. Yeah, Benjamin was 10. So a 10-year-old boy that lived in Nazi Germany. And Hitler was his imaginary best friend.
Oh.
Oh, girl.
Oh, this sounds real juicy.
Yeah, so it's like satire, satire, it's comedy, it's drama, it's all of it. But even my 10-year-old said, "Mom, this seems like propaganda." And I was like, yes, because this is what we were seeing, right? 24/7 death toll ticker. Somehow overnight, the HHS told the hospital systems, you are going to stop treating people the way you normally did, and you are going to use this protocol. And so everything that we knew as a healthcare provider went out the window, from masks to wearing the gowns. Like, if any infectious disease team saw us walking in the hallway with their gowns, or coming out of an isolation room and taking off our gowns, or touching our mask,
oh my gosh,
Lindsay, we would have gotten written up.
Off with our head.
Yep, totally.
Yeah.
So,
so this is like a new overnight protocol.
Overnight.
So weird. Like,
yeah.
Okay.
Yeah. And so, and here you're going to wear these masks. And so for me, initially I was like, okay, well, we never did it for flu.
Right.
So how big is a flu virus? Oh, 0.2. Well, how big is a corona? 0.1. Okay. Well, how big is a TB? Because our gold standard in the hospital, the most infectious aerosolized disease that we have in the hospital floating around is TB. So when you have a TB patient, tuberculosis, you had to put them in a negative pressure room so it didn't go circulating through the vents, and you had to wear an N95. So I look at the box of the N95 and it says 0.3 microns is a TB. And so I was like, so TB is, triple the size of a coronavirus, and we use N95s. Like, there's nothing that we have that's going to work except a PAPR, you know?
And by the way, as a non-nurse person onlooking, I recall all of the medical professionals at this time saying, we don't know much. We don't know much. They thought it was airborne. They thought it was surface borne. Like, they didn't know anything. So it's really funny that they so quickly implemented new policies and procedures for you guys based on all these facts that they're then telling the public they don't have.
Well, let me just take you how a critical thinker should thinks. A master's prepared critical care nurse is what I am. It's like I didn't get there by not critically thinking.
Yeah.
And so when that was when I told my colleagues, like, hey guys, coronavirus is 0.1 and tuberculosis is 0.3. This isn't going to work. Oh, Jodi, it's novel. We're doing the best we can. Just put on the darn mask. And I'm like, no, I'm not playing this dog and pony show, because I know it doesn't work. And so, Lindsay, without going into the whole detail, it was one thing after another. It was shutting down, our non-essential surgeries, which is everything that's not going to imminently kill you, like a heart attack or stroke. So everything just shuts down. Hospitals make money off of surgeries.
Right. So that is kind of interesting.
Yeah, right. So where were they getting their money from to keep them afloat? Oh, they were getting it from us, the taxpayer, right? Because we're the ones who have to pay that $1 trillion back. Yeah.
And all of the new policies and procedures that you guys were being forced into required more PPE. Is that the word that everyone used? PPE.
Yeah.
So that hundreds of millions of dollars, I'm sure, is going out the door for all of that crap, which you just said doesn't work.
Oh, you mean the stuff that I would get shipments from at our federal facility from China that has like Chinese writing on it?
Oh my
Oh, yeah,
gosh.
no, that's what the PPE that we were using at Phoenix Indian Medical Center.
I should have brought a whistle to this podcast. I need to get better about props. Props are awesome. I'd be like, she's blowing the whistle.
Yeah. But at the end of the day, we knew what it affected,
Yeah.
right? And,
Yeah.
and with any disease, we know like does it affect your heart? Does it affect your nerves? Does it affect your brain? Or does it affect your lungs? Oh, shortness of breath. So it affects your lungs. So if it does that, what's the route of entry?
Don't ask. I'm
Your
like, don't ask me real questions because I don't know the answers. I'm like, I'm here for you. Don't even ask me simple questions like, what's 2 + 2? I'm like, this is your interview.
Yeah. So it's your nose and your mouth, right? Essentially, they were getting us to buy toilet paper. They were getting people to wash their vegetables and their fruit. We knew that it was respiratory route. That's why they said to put the mask on. That didn't work. But so it was just the fear, constant fear. I also worked prior to this in detox and recovery. And I would see, all of the people that, my previous patients that I follow on Facebook, like they were struggling. I also, was dancing at the time. And then the dance community was struggling.
A stripper or ballroom?
Hip hop.
Oh. I love that you didn't flinch when I asked if you were a stripper. Like, oh, no.
Bartender.
There was zero offense there at all. That was awesome.
We did all these things that just did not make any sense. And I was very vocal about it from the beginning. And then they asked me if I wanted to be hospital supervisor. And I was like, sure. Never done it before.
Why would they ask you to be a hospital supervisor if you were the one like calling out the crap?
Well,
do you think they were trying to promote you to shut you up?
No, they needed me. They needed my skill set. And because remember, we also let everybody take 2 weeks off that tested positive. Yeah.
And were a bunch of other people not coming into work because they were so scared? No,
they would just come in and, say they tested positive.
I can be here. I'm already sick. That's hilarious.
And then there was also that whole, the whole close contact.
Right. 6 feet apart. Yeah. Okay.
Well, no, contact tracing. So, like, for example, my supervisor, like one day she's like, hey, you were a close contact. Your patient that you brought to the 4th floor, they wound up testing positive. So can you go to OC Health and get tested? And I was like, no, why would I? And she's like, well, because you were a close contact. And I was like, well, then that's if you believe in asymptomatic transmission. I was like, I don't believe in it. I've seen the research. Do you want me to show you the research? And she's like, well, listen, like, can you just go down and do it?
Can you just do it? Please don't make me think. Please, I don't want to argue truth with you. I just want you to do it and leave me alone.
Well, but you also have to remember, so I was float pool. So I worked ICU, ER, and hospital supervisor. So hospital supervisor is like admin, right? Administration. Okay. So I saw what HHS was telling the hospital administrators to do and then to pass along to the doctors and the nurses. So I knew what policy was. Right. And so she's like, well, do you not want to know if you're positive or not? And I said, how do you know that I don't know already? And then she goes, well, do you? And I was like, maybe. And she's like, Jodi, will you just go take the test? I said, no, I'm not taking it. I said, I'm not taking it. It's an emergency use test. I've seen way too many false positives come from it. I know that if I go, let me ask you a question. If I'm positive, do I still have to come to work? And she's like, no, we'll discuss it. And I go, right, based on my symptoms, right? And she goes, yes. And I said, okay, so I feel fine.
Yeah, my symptoms are 0 right now.
I'm not going to be another number. I'm
Yeah.
not going to
Good
drive
for
these
you.
numbers up,
Good
you
for
know?
you. Tell me
And
about the false positives.
okay, well, so the PCR test, was never intended to be diagnostic. We never test people and say, you could possibly, it's like going to, even say your HIV screenings. Most of the time, like if you feel fine, you're fine, right?
Right.
And
Okay.
so, like for even HIV, there's symptoms that happen. There's like flu-like symptoms. There's all these things that happen. We don't just go around telling people just go take a test. If
Yeah.
even if I mean, maybe if you are a high risk individual, but if you're not, we don't recommend them. So
Right.
why are they recommending this for this, right?
Yeah. Yeah.
And so and then I looked at like what the cycle thresholds should be. So I just did research, Lindsay, research.
How silly
And
of you.
yeah, and my laboratory diagnostic people, they couldn't tell me how many cycle thresholds that we were running at until I found one person that said that the test ran for 52 minutes. And from everything that I had read, no max it should have been 27 minutes.
Interesting.
So the PCR is essentially they take a fragment of something and then they magnify it. It's like this polymerase chain reaction is what it stands with, but essentially it's a magnification process. So they're like magnifying it, magnifying it, magnifying it, waiting to see if they see a fragment of what they're looking for. So if you
Okay.
continue to magnify for 52 freaking minutes,
Eventually you got to find something.
yeah.
Yeah.
That's how I understand it. And
Wow.
so that's why I, say, and then the numbers, so then we also have people that, like I said, are asymptomatic. They're coming into the hospital with a gallbladder, right? I had one lady pregnant. She needed a gallbladder out. She got her gallbladder out, but before she gets admitted, before anybody got admitted into the hospital, we had to test them.
Oh my
So we
gosh.
knew what room to put them in. So we had a bunch of people that weren't even symptomatic, literally on the floor with all the sick people.
Oh my gosh, that's so stupid. It's stupid.
It's
And
evil.
they're in pain, right? I mean, this girl's probably in pain. She needs her gallbladder removed. No. Even though there looks to be absolutely nothing wrong with you, you sit there in pain while we run this test.
Well, absolutely. So, I mean, they would got the gallbladder out, but once she, left that surgery, she got admitted onto the floor with the COVID patients as a surgical patient.
That is so ridiculous.
There's a lot. I mean, there's a lot that we've
But
done.
there's everything that we, the people, knew was happening, and we're waiting for somebody, anybody at all, to speak up and say, "This is happening," and I'm proof. I'm boots on the ground. I'm in the
Yeah.
war room, and this is so. So tell us about coming out and exposing all this.
Yeah. So, like I said, I had been talking to my colleagues, but it just depends on where people work, what unit they work on, right? You're going
Mhm.
to have the ICU nurses that are going to be saying like, "This is horrible," right? Well,
Right.
you're an ICU nurse. You deal with horrible.
Everything you see is horrible. So
Everything you see is horrible,
yeah.
right?
So your gauge is a little off.
That's right. And then you also have like the ER nurses, where a lot of us are like, we see people come in and we see them leave. And then we were telling people for the first time ever, okay, you are sick. You're noticeably sick, but we can't admit you because your oxygen's still normal. So just go home, do nothing, take Tylenol if you need to, which is horrible, by the way. Um, do that and then go home and try to stay away from your family if you can and come back if you have problems breathing. And it's like,
Hmm.
wow, this just didn't make sense. And I saw people trying to help. I saw doctors there trying to, prescribe. And, then, the hammer just came down on them. So essentially, Lindsay, I mean, in June of 2020, I actually had enough like educating the public and really just asked God, like, I'm getting off of Facebook. I'm getting off of all of this because I got attacked more in March to June of 2020 than I have this entire 2 times since I've blown the whistle.
Why is that, you think? More people
Because
waking up?
No, because I think people recognize the truth. Like I showed them. I wasn't telling them anymore, right? I wasn't giving them. I was like, all right, I've done all this. I've tried to educate. So let me just show you. And that's what was laid on my heart to do. And then I realized also it's like when people suffer from propaganda messaging, they lose the ability to critically think.
Right.
And so they're detached. So you have to hit them on an emotional level to snap them out of it.
Gotcha.
And that's what I think my video did. It snapped them out of it. Or those people that were towing the line for society, should I do it as a virtue signaling kind of thing, that I did my part, BS, even though, God is telling me not to. Some people call that instinct. I call it, God. It's like, you better not, you might want to think about this, the Holy Spirit, whatever you want to call it.
If it goes against your own sanctity of preservation, it's probably something supernatural, like the Holy Spirit.
Absolutely. Just like our thoughts are supernatural, they're supernatural. And depending on what spirit, I like to say you're led by, is what's going to come out of your mouth. So if I'm led by the Holy Spirit, you're going to hear me, 99% of the time speak love and kindness and stuff in the world, right? Maybe 80-20, maybe 20.
Am I on my period? Maybe there's that 60%.
Depends if I get really triggered. I definitely can go a little ghetto on them, but
that's funny.
I try not to. Or you can see the other people that are spewing hate and mean. Like you get attacked a lot. Like when I see people attacking you and talking, I literally see demons like that are possessing them essentially. And they just don't know. They don't know it, but so that's the story. I decided to record, and the one organization that I had started following a few months prior to that, where Ivory Hecker came out, CNN, April Moss came out with Fox, all of them. I was like, okay, I need to do something bold. And that's why I recorded.
So good. I'm gonna attach that video into this episode too. We're gonna.
Really?
Oh yeah, you gotta send it to me though.
Okay. You may want to rethink that. They might ban you for sure.
Oh, I might get another strike on YouTube. I actually can't even post on YouTube right now because of it. But
yeah, you know what I do? I just forward people to Project Veritas Insiders, and then you can see all the clips. So projectveritas.com Insiders. And I encourage people to go there and look at what has been exposed, because you see every whistleblower video there.
Yeah, and unless you're following that page, which a lot of people aren't now because of James O'Keefe, unless you're following the Instagram and seeing little sneak peeks here and there, you don't really know everything that's being exposed.
Right.
Most of the time, you only see what goes viral.
That's right. Yeah. Exactly.
So
that's sharing it. That's why I tell people you got to share.
Yeah. So are you still nursing? What has all that done to I'm sure it's uprooted your life in so many ways. What is it changed?
Well, I've gained about 50 pounds since March. So if there's anybody out there that wants to put me up for a couple months and fat camp and feed me and keep me on the schedule.
No, not feed you. No feeding. You could put her up and just give her water. Just kidding. I think you look great. I would never have even known that.
Oh yeah, girl. It literally, I mean, my life completely changed. I was a free spirit. I still am, but I traveled all the time. I loved nursing. Absolutely loved it. I picked my own schedule. I could tell them hey, I want to work these 8 days in a row and take 2 weeks off without getting, using PTO. It was amazing. But after the video came out, I had to go in front of the Arizona State Board of Nursing and they ordered me. Well, I had to do a whole investigation for like 6 months. And then they ordered me to undergo an ethics evaluation. And I did. And I was cleared of all wrongdoing.
Yeah.
Yes.
Good girl.
So that was pretty big. And then, like I said, after meeting people, you know how you are who you are, and you and I are talking because we're just, this is who we are, and this is how you know me now.
Yeah.
I look at it like people saw that. Well, let me go back. I just kept hearing like you're a hero, you're brave, your courage. Oh my gosh. And so then I realized, like, oh my gosh, we don't have a pandemic of like COVID. We have a pandemic of cowards.
Yes. Yes.
Because if, just literally what 3% of us stood up and said no out loud, we would have changed the trajectory of this.
Yep. Yep.
And so then I wrote my book for some time, flying around, doing speaking engagements. Not a whole lot, I might add. Not a whole lot, which is very odd. You hear these big ticket, big name, freedom things that you see all the time. You never see any nurses on there.
Right.
And so it's very odd to me why we didn't have any of the nurse whistleblowers. Like, we outnumber doctors 10-1 in the hospital. If you're really wanting to change the culture in the hospital, you got to get your nurses to do it, because we can refuse orders, right? And as long as it's like a safety thing, like, we could have educated, we could have done that. And so I'm more busier now than I was when I blew the whistle.
Yeah.
And I think that's just because it's God's plan. I mean, I look at it that way. I never went out and sought all of this.
Right.
I offered, but I didn't seek it. What I realized, Lindsey, is that I am probably 50-50 introvert, extrovert.
Interesting.
Whereas in 2020, I would have been like, oh, I'm probably 80% extrovert.
Here's an interesting thing that just occurred to me, because you and I are somewhat in the same boat. We both, in the middle of this, somehow got clarity, probably the Holy Spirit, right?
Yeah.
Into like, I don't know why, but this just isn't sitting well. And I'm no different than anyone else politically or socially, but I'm not okay with this, and person B is. So what makes us so different, right? And the minute you take that clarity and you put it out there in the world, correct me if I'm wrong, because this is how I felt. I felt like when I opened against the mandates, it's not that big a deal. It's my right to literally work, and that's what I believe. People will be supportive because I have 3 children, I have a home, I have 6 businesses. It's going to be very obvious to them that this is 2 weeks to flatten the curve is now 6, so we were lied to, and they would sympathize with the state of my life that I'm in going bankrupt if we stay closed. So I didn't speak. I spoke up thinking I would get support. Did you also think when I speak up, people will be grateful that I'm exposing this and that I'm opening their eyes? But what really happened, which is why we would never try to do this, which is what the left claims for fame or clicks or follows, is, or because we're grifters, is so much hate came that was completely unexpected. And you're like, oh, trust me, if I knew you were going to hate me this much for telling the truth, I wouldn't be quiet. I wouldn't sit down and go back. But it's like, I might have thought a lot harder about doing it.
Yeah. And for me, it was the opposite. I was like, I'm going to get a whole bunch of hate because I'm a nurse and I'm going against mainstream, the mainstream media, right? What everybody knows, even my own colleagues, weren't stepping up and saying anything. So I actually expected a lot of hate.
Interesting. Okay.
I had to deal with a lot of lawsuit BS and all of
Yeah.
that and
Yeah.
investigations. And, my whole schedule was changed. I had no schedule anymore, and here's another thing. When somebody has an addiction and you take away their routine and their livelihood, and essentially give them, like they say, idle time is the devil's playground.
Mm-hmm.
Most of them are going to go back to their addiction. And that happened to me. I lost 50 pounds before I turned 40. And now here I am, 46 years old, and I'm starting, slowly crept on, all of the like going, and flying here and your schedule changing and eating on the road and doing those things. Like, it just crept up. But, probably last year and a half, it's like I've noticed a significant difference. After my book came out, I was like, whew, all right, now, Jodi, you need to focus on yourself.
Yeah.
You
So the
know,
book, what is the purpose of the book? To really get all of the details out there, and is there the facts and the studies and
Mhm.
like, okay, good. And then
Well, no, it tells a
grimy.
story. Yeah,
Okay.
no, so it tells a story. It's most people say they read it in like one sitting, maybe
Mm-hmm.
two. It's 150 pages. It takes you through my post, and then the story unfolds. So the short answer is it's my journey as a critical care nurse in a federal hospital through COVID and how my faith got me through it all.
Oh,
But
amazing.
yeah, that's
Good.
the whole
So
basis.
it's probably pretty empowering, I would imagine.
Yes, and it
Good.
has been, and so I just need people to share because,
Yeah.
it's, the social media, it's like, I do it all on my own, and it takes up a lot of time. I understand now why people, social media managers and stuff make like 2,
Mm-hmm.
3 grand,
Yeah.
you know?
I know I've had days where something goes viral or something is a big deal, and I'm constantly managing whatever it is. And at the end of the day, I'm like, I can't see past like my hand. I'm gonna just oh, that is the devil's playground. Also, is social
Ye
media. Whew.
Yes.
Yeah,
Yeah.
it's hard.
It really is, and you can sit there and it takes up hours, and you're like, "Oh my gosh," you know?
Yeah, before you know it, you've scrolled all through the day. Yep.
Right, right. Yeah, and so, yeah, I mean, it just, it's been a process. Like, life is good. I'm doing a lot of work with legislation, working very closely with Senator Shamp here in Arizona.
Good.
We're actually having in May, which is pretty big, like a congressional like hearing, I guess you would
Mm.
call it. I'm so new to politics and all of this. It's like I may even be saying it. So I'll tell you exactly what it's called, which is going to be exciting because it'll be on record. We'll get, our expert take on it, and
Yeah.
it'll get on record. And it's called Novel Coronavirus Southwestern Intergovernmental Committee. And
Ooh.
we have like Pierre Corey, McCullough, Aaron Siri, Kristen and Tammy, our OSHA whistleblowers,
Mm-hmm.
and Senator Shamp, Gosar, Montenegro, Biggs, and Shope.
And what will be the purpose of this committee?
So the purpose of the committee is to talk about have presentations and a panel discussions on the public health protocol or the response, the hospital death protocols, the remdesivir, the experimental
Mm-hmm.
drugs, like
Yep.
what I said, taking away early treatment. How
Yeah.
did that happen? How did the coercion of experimental injections happen?
Mm-hmm.
Data transparency, medical or solutions post exposure to the spike, and medical freedom, the legal process. And so also too, I started working with 1000widows.org, and these are a group of widows that came together. It was just a couple of them at first, and they started noticing through talking, and that's why I encourage people to talk to one another.
Mm-hmm.
They noticed that their loved one died in similar manners. So
Mm.
once they gathered people, they noticed that there were 27 commonalities.
Wow.
Yeah. And that's how 1000widows.org was born. And
Oh my
so,
gosh. So these are women that, or women.
Women and men.
Okay.
And family members, like
Yeah.
sisters and
That all said, not just because, we're called conspiracy theorists for saying, oh, he had a heart attack. I bet he got the shot. So heart attack is just one thing. These people noticed 27 things that were in common between each victim.
Yeah, so it was like essentially the handling of it, right? So what happened when,
Oh, I
when you
see.
brought your loved one to the ER? For many
Okay.
people, it was the last time they saw them. I mean, that goes against our Bill of Rights. That goes against ethical principles we take.
Yeah.
The government comes out, says that there's this deadly virus, jacks up all the numbers, creates and promotes fear. And then you have us that are actually working in this environment and being like, it's not so bad here. It's not so bad. And they're like, well, maybe it's bad over there. Maybe I'm just waiting for it to come to our hospital. You see what I'm saying?
Yeah.
And so people just like kind of fed into it. And then once they got into the hospital, we took away the use of steroids in the beginning. We were intubating people without, proper reason to do so. We were giving them experimental drugs, Lindsay. Remdesivir was experimental. It had just failed the Ebola trial
Oh my
by killing
gosh.
53% of the people in that trial. And then we go ahead and use it in our hospital. That is the
Wow.
only drug for COVID with
While
a 20% bonus payout.
while demonizing ivermectin and all the other treatments that
Yep.
the public would say, hey, I tried this, it worked. Don't say it, don't talk about it.
Yep. That's right.
Wow.
And then the National Council of the State Board of Nursing and all of the other medical associations, they came out and said, we are going to take away your license if you talk about this, because they called it mis and disinformation. Again, this isn't how science works.
Right.
Science is about data and discourse. We have got to be able to continually talk. And if you can't talk, then you don't have science anymore.
Right.
And so for me, it's like I just stuck on my ethical principles as a nurse. And when people said, Jodi, be careful of saying that. You don't want to talk about that. I would say, let them come after me. Because this is the oath I took. I didn't take the oath to the hospital administrator.
I didn't take the oath to get paid for every person that's that checks in the test positive.
That's right. Yeah. And now you see going around how doctors have been incentivized to have you seen that? Like the Blue Cross Blue Shield?
Oh
Yeah.
yeah. Oh yeah. Not at all surprising.
It's not. Yeah. But, throughout all of this, it's like, you just meet amazing people and, other people that are in this fight. And, now we're at the point of like, okay, well, what's the solution? Like, what are we going to do? We can't be talking about this over and over again.
Right.
Let situations like this happen. Let these committees happen. So it's public record. But, it's about solution now.
Right. That's the other question I was going to ask, because is this going to hold people accountable to what they did and then make changes moving forward?
Well, I'm hoping to see justice. I personally don't believe that the hospital system can be saved. They are absolutely run by billionaires, and everything we see around here is just, pretty much a handful of billionaires that are running it. Our government, the FDA, CDC, hospital systems, they're running it. So I want to hold them accountable, but I also, I've had domestic violence before, and this feels like it. I'm not going to try to go back to a system that I know I'm not compatible with.
Right. That's abusing you and gaslighting you and making you feel like the crazy one for speaking up. Yeah.
Right.
Good for you.
And so a lot of nurses are leaving the bedside. I know the National Council of the State Board of Nursing came out and said like they estimate that 100,000 left because of the pandemic.
Wow.
And I was like, they didn't leave because of the pandemic. They lost lost because of your policy to the pandemic.
Yeah, they lost because they don't trust you anymore, and they don't want to live a life of lies, treating people the way that
Yeah.
they shouldn't be treated.
Right. That's exactly right.
Wow.
And so now there's like functional medicine training that a friend of mine, she's a friend of mine now. I have the link in my bio, but it's like functional medicine training for nurses. It's about $2,000. You can open up your own practice. You can order labs for your patients.
Wow.
Yeah.
Oh, that's
$5
cool.
labs, CBCs, like labs that are actually going to do something. You can recommend supplements, to them. We just
Right.
can't diagnose. I can't say to you, it looks like you have diabetes.
Right.
I can say, it looks like your blood sugar is high, and this is how you combat it. That
Gotcha.
kind of thing, right?
Okay. Mm-hmm.
So a lot of nurses are leaving and doing that as well.
Yeah, and more people, myself included, don't trust the medical community.
Mhm.
Before even all of this blew up, I mean, even without the whistleblowers, just the critical thinkers are going, no, 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 this is not right. And now it's down to the vaccines too, like getting my kids vaccinated. If I can't trust you, then that means I can't trust you with anything. It's a ripple effect across the medical community.
Mhm.
I'm not getting any more flu shots. My kids
Mhm.
aren't getting any more vaccines. If I
Mhm.
don't feel good, I'm going to call somebody like you or the
Mhm.
wellness company. Like, I'm not going to a regular doctor
Yep.
that's bought by Big Pharma.
That's right. That's right. And that's where people are. Lots of doctors are leaving too, and they're developing these private medical associations. That's what TWC is. They're
Mhm.
popping up all over
Good.
because people and nurses are having it, like Nurse Freedom Network. And
Yep.
we're starting remnant nursing, and remnant nursing is requiring every nurse to be functionally medicine trained because we want to get out of the allopathic sick care system.
Right.
And we can treat people if you take out the insurance portion of it, and you're not paying for that anymore, and you're paying cash to the person that's truly helping you, you're going to save money essentially in the long run. The
Yeah.
only thing is like maybe major medical if you have to be hospitalized,
Right.
but even then I'm like, whatever, I'll pay him $10 a month.
Yeah. Yeah, exactly. Yeah. I'll just owe you the rest of my life until I die. Yeah.
Exactly.
Yep. Insurance is a scam too.
It totally is. See,
Ugh,
that's what happened, Lindsay. They overplayed their hand
they
because they
did.
woke up people like us
Yep.
and we're like, I don't trust you here, here,
Yep.
here, here. Yeah.
And you know what happens when I don't trust you? I don't give you my money. So you lose. You lose by losing my faith and my trust. You cost yourself.
Yes,
Yep.
that's right. And now I pulled my kid out.
Mhm.
It's like he hasn't gone to a public school since 2020.
Yep.
And then I tried another faith-based school, but I figured, you know what, since I'm home, I'm gonna homeschool him. And
Good
so
for
he's
you.
been with me this last year. But yeah, like I'm done.
We
Like,
are. We're the little homesteading women now. You
yes.
ruined us. Oh, they are though. They're pushing so far that the
Mhm.
pushback is going to revert us back to
Yep.
the way that God intended, which is parents to have control over their household and
Mhm.
women to raise and nurture their children and protect them at all costs and to be vigilant and paying attention. And that
Mhm.
is what we're seeing. And we didn't even do that. They did it to us.
Yep.
And the consequences are going to be their own.
Yeah, that's exactly right. I mean, they wanted to get their little shot in every arm so bad that they are losing all their other shots that
Hmm.
they were making bank on.
That's right.
Physicians included. Like, I didn't know that they made money on, how much of their, like, I think it's something like over 60% of their patients have to be fully vaccinated for them to get the highest payout, which, if a doctor had like 2,000 patients, which is nothing for them to have, they would get, that would be equivalent to like $150,000 extra for them a year.
My gosh, that's insane.
It's
You
insane.
tell me that that's not like believable. I mean, of course it's believable. Doctors make money and you offer that kind of incentive, whether or not they believe that the shot was going to be harmful.
Mhm.
That's good money.
Yep. It's
That's
good money.
that's incentivizing money.
Yep.
And
And
I
here's Mhm.
I told people on Instagram when I shared that thing, I said, your life, because this is what it is. He put up your doctor put a poison into your body that he or she did not know the extent of. Your life is valued at $125 because that's
Yeah.
how much extra they got by vaccinating you.
Yeah. That's right.
That's a
And
pretty
even
poor amount on someone's life.
it's horrible. And what about our babies? You know, like
Mhm.
I started working with Children's Health Defense a couple weeks ago, just picking up a contract position to try to boost their military chapters and Native American chapters. So anybody, you know, that's in one of those areas that want to get some education, you know, let me know because I'm working closely with them doing that. But they've had all these studies, like all of these anti-vax moms, like they knew
Mhm.
what was up.
Yep, they
They knew
did.
what was up
We
before,
were
way
calling
before
them
COVID.
crazy. We were
Yes.
calling them crazy. I feel bad.
Yeah, me too. Me too. I apologized to them. I was like, you guys are the real heroes, like because
Yeah.
you stood up and you did change legislation and stuff.
Mhm.
So because there's no studies on like the cumulative dose effect.
Right.
There's, you know, physicians, they know just about as much as you and I when it comes to vaccines. They don't really know the ingredients.
They just
Not
get paid to
all of
put them
them.
in.
Yes, this is our training in medical school and nursing school.
Mhm.
Here is the recommended schedule. This is what we vaccinate for. They're safe and effective. Make sure everybody knows that.
Yeah.
That's
Yep.
literally it.
So
We
sad.
didn't hear what the ingredients were or how
Right.
they necessarily work, you know?
Yeah.
So, yeah.
She's blowing that whistle, folks. All right. Well, tell everyone where they can find you, support you, buy your book, etc., etc.
Yes. So yes, you can find me speaking truth on Nurses Out Loud. That you can just type that into any podcast. I created a show with 4 other nurses, so you have a different nurse host daily. It's on the America Out Loud Talk Radio app or iHeartRadio, 10 a.m. And 11 p.m. Eastern Standard Time, and then all of the shows go to podcast daily and any podcast app. You can find me directly at jodio'malleyrn.com, where I am creating courses in confidence, courage, and calling, because I feel that's really where people need help the most so that they can find their voice and speak the truth. We need more people doing that. And also, I have a retreat coming up in Alaska. Oh my gosh.
Ooh.
Oh, I cannot wait. We have one date right now, but we're looking to maybe add some more. I haven't released that publicly yet, but
Oh,
the
you heard it
information,
here first, folks.
you're hearing it here first. And yeah, I think that's it. I
Okay,
think that's it. I'm
amazing.
on social media at jodio'malleyrn.com or
Okay.
Jodi O'Malley RN.
And is your book on
Oh,
jodio'malleyrn.com?
yes, thank you. I
Yep.
forget
Okay.
about my book. Rare Courage, standing for right when you're surrounded by wrong. You
Mhm.
can get it on my website, or you can also get it on Amazon.
All right. Amazing. You are a powerhouse. Thank you for sharing truth with everyone. I'm so glad that it's at least blessed your life, but we appreciate you.
Yeah, thank you, Lindsay.
All right. And we got to do a cheers.
Okay. Oh, I got my protein shake.
Yay. I got my water.
Awesome.
All right. What are we cheering to?
Oh, let's cheers to the remnant rising.
Love it.
Yes.
All right.
Speaking
Thanks,
truth
Jodi.
in this world.
Speaking truth when surrounded by wrong.
Yes.
Thanks for being a guest.
Thanks, Lava.